more. How quality is your menstrual health education? What type of access do women and girls have to these products? What is the quality of the policies that we have within our national gender equality policy, or even within the workplace? What is your policy like when it comes to menstrual health management? And basically, here, I'm not going to read all of this in the interest of time. So it focuses on menstrual health, menstrual equity audit, really examines what I just mentioned: your access to menstrual products, your access to bathroom and sanitation facilities, policies and support systems. Once we're going out into these communities, we're going to the classrooms, we're educating the boys and girls, we're educating their parents, we're educating our gender officers, our health officials. After we've done that, what is the impact? What is the outcome of all of that? How does all of this work truly ensures and protects period-friendly spaces here on Nevis, here in the Caribbean also? It is also important that we've gathered all this data, because data gives us the evidence and it leads us to action. So what is the call to action? What we're doing here right now, you've taken the time to sign on and to listen to these conversations and to see what we can take from these conversations that we're having, come together and put it to work. So together we can create a period-friendly Nevis, a period-friendly St. Kitts and Nevis, a period-friendly Caribbean, a period-friendly world where anyone who is a menstruator, they can have access to all these facilities that I've mentioned. They can do that safely, they can do that in confidence and in privacy, and they can do that with dignity. So partnership is a key thing here to ensuring that we have these spaces. So keep talking, keep having your podcast conversation, keep having your webinars, keep having these functional collaboration with government officials, government offices, government agencies, CSOs, NGOs that are doing fantastic work on the ground. Keep gathering the data, keep speaking, and of course, keep supporting our girls, because they're looking for people to support them and to give them the information that they need to ensure that they can dwell well within these period-friendly spaces. So you can connect with us at the Department of Gender Affairs. We are active on Facebook at the Department of Gender Affairs Nevis, or you can give us a call there with the number on the screen, or you can contact me at my email address. And if you have any questions or any way that you would like to collaborate with the Department of Gender Affairs Nevis, then we are open to have a discussion with you. So let us really push forward for a period-friendly world. Let us support our girls and support our boys. They are ready to take this menstrual health education by the horns. Thank you.
Wonderful. Thank you so much, Ms. Hendrickson, for your thank you so much, Ms. Hendrickson, for your presentation and for setting the scene so nicely and explaining to us what a period-friendly world should look like, and also for just sharing all the great work that you're doing in Nevis. And we just like to applaud you for all your hard work and dedication and your passion for the cause. So thank you so much. So I'm now going to hand over to our next speaker. I have to apologize to everyone. I'm having some internet issues, so I may drop off every now and again, so I do apologize. So it's my pleasure to introduce the next speaker, and that is Ms. Nyoka Gumbs, and she is a community health advocate, and she's going to share her personal experience. And so I'm going to hand over to Ms. Gumbs. Over to you.
Hi, good evening, everyone. My name is Nyoka Gumbs. I was born and raised in St. I work as a construction project manager, and that's why my role here is as an advocate. I was introduced to Saros more on perimenopause, menopause education, but in a conversation with Saros, we realized we had to go back to the beginning, right? To my introduction to menstrual health, and realizing that the importance of understanding this from adolescence, because that's where some of the misunderstandings and the gaps in my education and the disconnect with my body started. And so we know that the truth is that girls need to be first taught what's happening with their own bodies. And so, in talking to Saros, this conversation is really like a replay of a conversation we had. And then I pulled out notes that I thought were of relevance to this space. Initially, I thought I would be seeing more young women. So, I wanted to talk to them from a big sister aspect and let the experts later speak to some other. Using other language. So I wanted to keep it simple. My first experience with menstruation, came home from Sunday school. On my slip or my petticoat, it was white. There was blood on it, and I thought I had a cut. I didn't know what it was. I was afraid. I was confused. I kept checking my body to see if there was a cut anywhere. I wasn't seeing anything. I was afraid to say anything to anybody in the family. And my mom ended up seeing the blood on my slip. And then that's when she explained to me what was happening and gave me pads. But even after that explanation of what was happening, I still didn't understand what was normal and what was not and what to expect. So one of the points that I was making to Saros is that academically, I was in the top class, the 1As, whatever, and continuing up. So imagine being academically strong, but then you don't understand something like your body and what's happening with you with your period. And that part of that is because that education was missing. They ended up having something called, I think we had a couple of sessions of something called family health or something like that. But the focus was more on pregnancy and anatomy, right? And so how do you skip over menstruation, which from a female perspective is what leads to pregnancy, but I think it just had a more pregnancy prevention tone rather than talking about menstruation. And so, of course, here today, I want to advocate for more of that education in schools, at work, in the community, in churches, and, encouraging greater compassion and support that way. I didn't have any discussion about menstrual pain. I didn't have any discussion about irregular periods, the emotional impacts during that time, and to even know when symptoms were normal. So while I understood academics, I didn't understand my own body, and that carried through into adulthood, which is why I came to Saros, because it would be like a vengeance. And the way my mind process it is like if it skip a month, when it come back, it's like twice the pain would be happening. I would be in such pain. I would have vomiting, nausea, diarrhea, just severe symptoms. And no, there was nobody to explain to me that that was not normal, right? I would go to the doctor every time because it wouldn't be every month. So whenever it happening, I would feel like I was dying. And so I would end up going to the doctor. Somebody's mic.
Sorry, please, can you mute your mic just to avoid disruption? Thank you.
So there was nobody to tell me something was wrong with that. And so one of the things Saros and I pulled out from that is I was going to doctor, and she was like, well, what doctor were you going to? And I was going to basically the same doctor I'd been going to from since a baby, right? The family doctor. So basically I was going to a pediatrician, and he was a general practitioner. There was nobody to say, hey, this girl needs to go to a gynecologist, right? So I'm going constantly to just my regular pediatrician to manage period. And because I didn't even understand what was going on, I would be telling him, can you just make me stop? Do I have to have a period? I had no understanding that asking to stop my period meant no chance of having children. I'm asking for a hysterectomy, and I don't even know, not knowing that nobody in their right mind going to give an 11-year-old a hysterectomy. So there was just such disconnect, and nobody's filling that gap for me. And so I feel like when I reflect on that culturally, I think we associated gynecologists with sexually active women or adult women, but not knowing that as these teens dealing with menstruation, especially if there's abnormalities, you need to speak to somebody who has some specialty in that space. So I continued pushing through. In school, the impacts in school would be that I felt like when I had my period, everybody knew. I felt like all the boys in the class know, the teacher them know, everybody know, because I'm just not myself. I'm like curled up, I'm balled up. And it was a very embarrassing time. We know in the Caribbean, we're wearing school uniforms. You're constantly asking your friend, check the back of my skirt. No, check. See if you see any blood. You know what I mean? It's like this constant paranoia because there's nobody to explain it. I'm not sure if when I was growing up, we even had wings yet on pads. But let's say maybe that came. Nobody was pointing out, okay, these are the different options. Nobody's saying, I didn't know anything about tampons until I was an adult. And to say, maybe if you have a heavy flow, that you could use a tampon and have a pad as a backup, right? Maybe was involved. It was a family thing when I had my period. My father religiously would go find the bush that need to make the tea that would help ease the symptoms. So the entire family was engulfed in this pain, these painful episodes. But again, I am not being directed to any permanent relief. But I do appreciate the love and care that came out of that. But what I think this helped to produce is a normalization of suffering, and a reliance on home remedies, instead of actually investigating what was going on. And so I think as I maybe left St. Kitts, like I said, I've been here 33 years. I left to come to college. I was here for college at 16. So I started having dangerous coping mechanisms, right? When you're away from the bush, I don't have my father to go get the bush for the tea. Then I got introduced to Aleve. Naproxen is the actual name, but in the over the counter, the Aleve. And I would overdose on Aleve just to get through the most painful days, which is generally day 1 and 2, and part of 3. And the prescription on Aleve it's supposed to be 1 in 24 hours. I don't know if there's a 1 in 12 hours. I would take at least 4 Aleves every 3 hours on my days. Can you imagine what that was doing to my stomach? I didn't know that there was a danger in that. I didn't know that could have tore up my stomach. I don't know how to this day that didn't cause. I did that for many years, and because I would try to take it before it ran out, I had whatever system before it wear off. Let me take the next set. So I was, just imagine how many Aleves I was taking a day. And so that excess, again, not knowing that's not normal, right? And so that lack of education is really a distortion of normalcy. And I think that's one of the reasons why education is so important. And I'm really excited about this webinar and the work that all these groups are doing on the islands. Later in life, like I explained earlier, that lack of knowledge popped up. Fibroids that probably could have been growing, they estimated, from a young age, very slowly, with me not being aware, and then a certain time, maybe hormones. And of course, one of the ways that